Now, tonight in medical rounds, prostate cancer is the third leading cause of death in American men. In fact, 1 in 7 men will be diagnosed with prostate cancer during his lifetime. The month of September is dedicated to raising awareness of this disease. And joining us live now is Dr. Joseph Wagner, urologist and director of robotic surgery at Hartford Hospital. Good evening, Dr. Wagner. It's nice to see you again.
Thanks for having me back.
Well, there's been a lot of conflicting information, as you know, regarding the prostate cancer screening test known as the PSA test. What are the current recommendations for that test now?
Yeah, there has been a lot of controversy. A number of years ago, the United States Preventative Task Force recommended against prostate cancer screening. A number of studies followed that, showing that prostate cancer death rates were rising, as were metastatic rates of prostate cancer. So they've reversed that decision now and are more in favor of screening. And there's actually a very good study that came out earlier this week from Kaiser Permanente healthcare system. They looked at over 400,000 men, and they found that men ages 55 to 75 who were screened yearly for prostate cancer had much lower rates of prostate cancer death, and death rates overall were lower.
Oh, that's good to hear. Now, what are some of the treatments the Hartford Healthcare Tallwood Urology and Kidney Institute offers for men who do have prostate cancer?
Yeah, I'd first want to stress that treatment for prostate cancer is very individualized. It depends on a man's age, his health, how aggressive his cancer is. But we offer all the latest modalities: robotic surgery, the newest technology in radiology, chemotherapy, androgen deprivation therapy. And even though treatment is necessary for many men, about 40% of men are also candidates for active surveillance nowadays.
What do you want men to know about prostate cancer?
Well, even though it's very slow growing, that's certainly true. It's also the second or third leading cause of prostate cancer death in the United States. And the only thing we have to combat that is early detection. Early detection makes a difference.
It sure does. We have just a few seconds left, but I just want to mention that your work, along with your colleagues, was chosen to be included in the American Urological Association. Tell us what that means.
So we did a study on genomic testing where we analyzed the biopsy's DNA to determine how aggressive the cancer is, and then we can make better recommendation as to whether a man is candidate for active surveillance or needs definitive treatment with surgery or radiation. And we looked at how the tests differ so that we can sort of pick the right test for the right person.
That sounds great. Progress towards better, more targeted treatment. Thank you so much, Dr. Wagner, for sharing this valuable information. I want to mention there is a free community education class coming up in Avon on October 9th called Understanding Prostate Cancer, Active Surveillance. What exactly that means. To register, call the number you see on the screen.